Let's get rock and rolling then. Let's look at radius and ulna. Those are the two bones of your forearm. Two bones of your forearm there. Now, a lot of times people mix up which is which. Remember that your radius in the anatomical position is always going to be on the thumb side. So radius is always on the thumb side. Ulna is always on the pinky side. PU, that stinks. Ew, that stinks there. PU, stinky. Pinky on ulna. So PU, pinky on ulna. So again, use this for your own reference. I'm going to bring up the doc cam and we'll go over all the landmarks. Alright, so we've got our two bones here to give you perspective. Okay? This is a hand, and this is a left hand, it's palm up. We got left humerus up here. And that means my spine my spine is going to be over here. So that just gives you an idea of what we're looking at. This is an anterior view, so we're looking at it from the front. Let's start with the radius. Okay? Radius here. Okay? It's got the rounded top hat looking thing. Rounded top hat looking thing. And so we'll start here. This again is superior. So this is above. This is closer to the head. So this is our head of our radius. This is our head. It's round. Essentially, when this comes in contact with the ulna, it pivots. Pivots like that. Twists and turns. So this is our head. And of course, we've got a head. That means we've got to have a neck. So there's the neck of our radius. Down here, okay, we got this bump. So if we turn to the side, you can see it's a little more pronounced. That's the tuberosity of our radius. And this is going to be on the anterior side. This is on the anterior side. Going down here, we've got kind of like, it's like a little bit of a raised sharp edge. We call this the interosseous border. Interosseous border, or you can call it the interosseous margin. And essentially, between the radius and the ulna, there's connective tissue. So we call this the interosseous border. Down at the bottom, then we got a pointy part. We got a styloid process. Remember, we had a styloid process on our skull. Pointy part, kind of like a stylus, like a pen. Same thing on our radius. Styloid process. And then the one landmark on the back side is our dorsal tubercle. Dorsal tubercle. Dorsal meaning back, meaning dorsal fin. So this is the one landmark on our radius that's strictly on the back side. So that's our radius. Ulna, okay, it's our Pac-Man looking bone. Okay, it's got that big old divot, okay, out. And in this one here, I want to drop right down to the head. Now the head of the ulna is opposite of the radius. So the radius head is up top here. The ulnar head is more distal. So here's the ulnar head. That's distal. Okay, closer to the bottom. Coming back up top here. This part here that sticks up, this is our olecranon process. Remember, process, anything that sticks up. And olecranon, that should ring a bell. Because we had, on our humerus, we had our olecranon fossa here. So what happens is, our olecranon process sticks into the olecranon fossa. And what this is, this smooth part here, this is the pointy part of your elbow. So this is posterior view. You can't see it when we look at it anterior. Okay, the back side of that. But again, we call this the olecranon process. Down here, we call that the coronoid process. Because guess what? On the front side of our humerus, the coronoid process of our ulna articulates with the coronoid fossa of our humerus. So again, this is our coronoid fossa of our humerus. So the coronoid process, and this part that sticks out here, coronoid process, that articulates with the coronoid fossa of the humerus. Next up here, okay, this Pac-Man looking opening. Pac-Man looking opening that faces anteriorly, so it faces the front. That's our trochlear notch. Because guess what? Our trochlea of our humerus articulates with the trochlear notch here. Likewise, if I turn, okay, and look here on the inside, we've got a kind of small, smooth surface. This is going to be our radial notch. And if I take my radius, this is where my radius twists. So radial notch, my radius twists. Again, this is going to be my radial notch. Now it doesn't stick out very well, but directly below the coronoid process, we got a tuberosity on our ulna. Tuberosity on our ulna. Like our radius, we got an interosseous border. We call that the interosseous margin. And okay, at the tip, we got a styloid process. We got a styloid process on our ulna as well as our radius. All right, so which is which? Let's talk about left and right. First, let's talk about the radius here. Radius. First thing, our dorsal tubercle, dorsal meaning back, has to be posterior. Now you can't see this from this view here. Okay, it's right behind, okay, on the opposite side. But our dorsal tubercle is going to face posterior. We know that our radius head is superior. So we look at top in green, looks like a top hat. Back in the 1920s, got the canes, got the dancing going on. So the top hat, the head of our radius is always going to be superior. And finally, our styloid process is lateral. Styloid process lateral. And I know it's lateral because if I'm standing in that anatomical position, my thumb points out. So notice, my radius is always on my thumb side. My thumb is lateral in the anatomical position. So my styloid process, my radius is also lateral. Unfortunately, the ulna, it's pretty much the same idea, but we got a couple things that are switched around. First of all, notice the styloid process of my ulna is medial. And that should make sense. The styloid process is medial. My ulna is always on my pinky side. Ulna and pinky, P-U. Pinky, ulna. Pinky starts with the letter P. Ulna starts with the letter U. So styloid process for the ulna is going to be medial. Because again, if I'm standing in that anatomical position, my pinky is closer to my hip, closer to my midline. Now we talked about the radius head and the ulnar head are flip-flopped. So the head of our ulna is going to be inferior. The head is inferior. And lastly here, up top at number 1, our trochlear notch. Okay. The big C part, the big Pac-Man part, that faces forward. That faces anteriorly. So that's how you can tell left from the right. Lastly, we've got 3 ligaments. 3 ligaments here that we're going to take a look at. One thing, if you print out the PowerPoint slides before like 30 minutes before class today, I forgot to make a change from last semester. Annular was spelled wrong. Or this is the correct way to spell annular. Annular. And so let's skip ahead to that one here. The annular ligament, which is in blue, that basically, it's kind of like if you ever bundled up sticks together and you put a rope around it. So the annular ligament, what it does is it holds the radius and ulna together. It prevents them from separating apart. And this is way up at the elbow. It's way up at the elbow. And it's kind of a confusing picture. It's a little bit confusing. But this is a medial view, so this is a view from the inside. This is a view from the inside. So basically, if I hold my elbow up here, like this, it's a view from the inside. In red, any baseball players in here? Okay, the ulnar collateral ligament, otherwise UCL ligament. This ligament will get stretched a lot whenever we throw overhead. Okay, so it lies right here. Okay. It connects the humerus to the ulna. Humerus to the ulna. And it should make sense there. Ulnar collateral ligament. And essentially what happens here is, over time, this gets stretched if we throw a lot and don't give ourselves enough time to rest. And if this becomes inflamed or tears, that's when Tommy John surgery happens. And it's becoming more and more prevalent in young baseball players because they throw too much too often. So the UCL, ulnar collateral ligament, it's on the ulna side. So remember the ulna is in line with the pinky, PU. So it's going to be on the medial portion connecting the humerus with the ulna. Likewise, the radial collateral ligament, that's going to be on the outside. It's on the lateral side. Okay. And that connects the radius, which is always thumb side, to the humerus. So, last unit here, we've got the bones of the wrist and the hand. Wrist and hand. Fortunately, I would hope you'll be able to tell the difference between a right hand and a left hand, so I won't quiz you on that. But let's start off with the wrist. The wrist. Now, this can get kind of confusing because in your wrist, we got a lot of small, chunky bones, irregular bones that kind of stack next to each other. We've got 8 of them in total. And this mnemonic device is how I like to remember them. The way it works is we're going to start on the thumb side on our bottom row of bones, and they're going to go to the top row of bones. Now all these bones that are in the wrist, we call them carpal bones. We call them carpal bones. So again, starting bottom row, starting closest to the thumb, we've got the scaphoid bone in red here. Scaphoid. Follow that up in blue with lunate. Then we got triquetrum in green. And then on top of that is your pisiform. Your pisiform. And this bone you can actually feel. You take your hand, go into your pinky side, okay, and you poke right on the outside there. That pointy part, that's your pisiform. On your bones, you'll notice that the pisiform and the triquetrum, they're probably going to be fused together. So it look like they're together, but hopefully there's a line or there's something. The pointy part that sticks up, it looks kind of like a zit. Okay. That's going to be the pisiform. Triquetrum is the body. So scaphoid, lunate, triquetrum, pisiform. Going back to the top row, left to right, we got trapezium and trapezoid. The way I like to remember it here is trapezium in the alphabet comes before trapezoid. I comes before O. So therefore my trapezium is going to come first in this row, then trapezoid. And then we got the capate bone, or capitate bone, capitate. And then lastly, hamate. Now you'll notice the hamate bone has a little handle on it. Hamate handle. Now the way I like to remember it here is this phrase here. Some lovers try positions that they can't handle. So some, scaphoid, lovers lunate, triquetrum tri, pisiform positions. That's trapezoid, that trapezium, they trapezoid. Can't capitate, handle hamate. So if it helps you here, this phrase, there are some other phrases out there, but if you memorize this phrase, that will help you know what order they're in and help you if we put a sticker on one of these 8 carpal bones, so you can let us know which of the 8 it is. And finally, again, this is a view from the anterior side, or a view from the palm. So I'm looking at it this way, like John Cena. Okay, you can't see me. Looking at it from the palm. Looking at it from the palm. So these are your carpal bones, bones of the wrist. Let's move on to the hand. In orange here, we call these are metacarpal bones. Metacarpal bones. And again, this is what you think about when you're looking at your palm here. Okay. You can actually see them on the back side of your hand there. These are your metacarpal bones. And then we get up to your fingers. These are your phalanges. Now the singular form for phalanges is phalanx. And so this is important to know. Phalanx is singular, phalanges is plural. This will be tested on next week. When we label these bones, okay, you need to be very specific where it's labeled at. The way we do that is we've got a numbering system. Number 1, 2, 3, 4, and 5. 1 starting at the thumb, 5 going to your pinky finger. So if I have letter A here, I put this on this green bone here. This is going to be a phalanx. It's one of your finger bones. So phalanx, because it's singular. One of your phalanges, phalanx. It's going to be first because it's on the first finger, or in this case, it's your thumb. And then finally, if you'll notice, in green, these are considered proximal phalanges. Blue would be middle phalanges. Red would be distal phalanges. So for letter A here, this would be a first proximal, because it's closer to my wrist, first proximal phalanx. Not first proximal phalange. Phalanx is the correct singular form. So first proximal phalanx. Letter B in blue here. That's your fourth middle phalanx. Fourth middle phalanx. Letter C, going down to our metacarpals, this will be our third metacarpal. So next week, make sure we're specific. Okay. Label the number on metacarpals and phalanges. Make sure we use phalanx, because phalanx is a singular form for phalanges. And then for phalanges, make sure we know if it's proximal, middle, or distal. Notice the thumb does not have a middle phalanx. And that's because it doesn't have as many numbers. There's not as many bones in the thumb. Now, whether we're talking about metacarpals or phalanges, they all have the same three parts. Base is a part of the bone, the phalanx or the metacarpal. It's going to be closer to the wrist. It's more proximal. Then we got the shaft in the middle. And then further out, the furthest end, that's going to be the distal end. That's going to be the head. It's going to be the head. So again, on letter A here, if I put this down here and I said, name this bone, make sure you say first proximal phalanx. If I say name this landmark, you would say, since it's labeled in the middle, you would say shaft. If I point it up here at the tip, okay, I would say, and it said name that landmark, that would be head. Question with the bones there. Different parts on those bones. Let's talk about the articulations. Talk about the joints. Let's start down at the wrist. Again, the name oftentimes is going to give it away. We've got the radiocarpal joint, is where the radius and the carpal bones come together. So that's right here in blue. Likewise, we've got the ulnocarpal joint for the same reason, where the ulna and the carpal bones come together. Now this is going to be a condyloid joint because my wrist has two actions. One, I can go forward and backwards there. Also, it can go side to side. Now notice, I can go a lot further towards my pinky than I can towards my thumb. A lot further towards my pinky than my thumb. And that's because there's such a big gap here. Such a huge gap. That's why that can happen. So radiocarpal, ulnocarpal. Down here, between each of these purple bones, between each of your carpal bones are going to be your intercarpal joints. Inter meaning between carpal bones. And again, those are gliding joints. They glide right past each other. No specific action there. Between our carpal and our metacarpal bones are our carpal-metacarpal joints. Carpal-metacarpal joints. And again, these are just gliding. Same idea. Now this one here is a little bit special. So this is the saddle joint. This is the saddle joint. Again, that's where the base of the thumb meets your carpal bones. So that's considered a saddle joint. Up here where you've got your first set of knuckles, okay, that's going to be your metacarpal phalangeal joints. In purple here, so metacarpal phalangeal joints. Again, those are condyloid. You've got two different actions that can happen there. I can wave my fingers like this, and I can go out and in. So two different actions there. And lastly, okay, in black, in red, and in green, those are all examples of interphalangeal joints. Or you could just abbreviate it as IP joints. Interphalangeal joints. Now all those joints are hinge joints. They're hinge joints. Remember, that means they can just go one direction there. Now, we want to be specific whenever possible. So on your second through fifth fingers, we got proximal interphalangeal joints. Otherwise, you could abbreviate that as PIP, proximal interphalangeal joints. In green there, okay, your distal knuckles, those are your distal interphalangeal joints, or dips. Now notice again, because we do not have middle phalanges on our thumb, we don't have, this is not considered a proximal or distal interphalangeal joint. This is just an interphalangeal joint. So this would just be that.